This is not Dr. Verdiales. No, but you know what? Dr. V, she's a very busy practitioner helping with women's health. And of course, when that happens, sometimes patients take priority. And it did today. So she couldn't be with us. But we will get her back for sure next time. In the meantime, things kind of have a way of working out because yesterday I filled in for Mike Gallagher for the GOAT. He couldn't be here and he didn't get to do his DMG presentation. So I did my age biogenesis presentation. Now you get to see the king of DMG. Here he is, Mike Gallagher.
Thank you, Joe. So this is one of our original formulas. This is one of the most unique formulas. It's also one of my favorite ingredients of all time, DMG. And we use it in a lot of different formulas as well. So last time I checked, over 40 different formulas we use this in. So to really understand nutritional frontiers, is to really understand dimethylglycine. It's not new. It's been around for a long time. Research on it, studies go back to the 70s. So it's been around, but most people have never heard of it. Or, whenever I talk to a new practitioner, they maybe have heard of it, but not quite sure exactly what it does and how it works. So we're going to talk all about it today. This is, again, one of special place in my heart here with DMG. So we have a PowerPoint presentation here. So we're going to pull that up as we just kind of go through this with this. So there we go on that. All right. So first of all, a lot of the studies and research that we are referring to is coming from a PhD molecular biochemist. His name is Dr. Roger Kendall, and he spent his entire lifetime researching dimethylglycine. And so and he wrote a book about it, and we'll talk about that in a minute. But again, doesn't it get any more science-based than a molecular biochemist breaking this down? Okay. So first of all, DMG does hundreds and hundreds of things. In fact, I just did a PubMed study on it, published medical studies on dimethylglycine. There's over 600 of them right now. So, but this is just a small sampling of it. So it improves oxygen utilization. It's a detoxifier. So that's why we use it in our detox formulas, such as our Live Complete, such as our Ultimate Shake now, such as our greens. Okay, just to name a few. It also boosts, enhances your immune system, which is why we use it in our Immunomax capsules or chewables. It helps with cardiovascular function. It's overall anti-inflammatory agent, which is why we use it in our X-Flame. It's an antioxidant, technically, by it, is how it's classified as by the FDA. Again, going back to liver, helps with detox, helps with brain, neurological support, and the big C, cancer, anti-cancer properties. And so again, folks, this is just a small sampling of it. But when I show this list to a practitioner for the first time, I always ask them what is the most important on this chart. And there's no wrong answer because they're all really good. But I feel the most important is the first one, improving oxygen utilization. Because viruses, all viruses, bacteria, parasites, spirochetes, so it is part of my Lyme protocol where I get 90% clinical success rate, and cancer cannot survive in an oxygen-rich environment. So the more oxygen we can get into the cell, the better, and it will help with all these other things. And DMG is one of the only substances that we can take orally that will actually increase oxygen. So again, to me, that is the number one benefit of DMG. So I mentioned it does many other things. Here's a few other things that it can help with. So any athlete, it helps reduce lactic acid buildup, improves muscle recovery. So again, trying for every edge possible. Also, I've had people who, long distance runners, marathon runners, and half marathons, they take DMG. at the very beginning, and then they take it halfway through, and they take it right when they end, just to really help. And they say they feel a difference and notice a difference. But we also have it in some of our other formulas, such as our Power Fuel. Okay, so with such as our Pro Oranges, we have it in there. In fact, all of our colors in there as well, and such as our Super Creatine. So again, we use it in a lot of different ways. The heart, I mentioned already, it can help lower cholesterol. It can help with circulation. It has been shown to decrease blood pressure, right? So great benefit there. On the immune, I mentioned already, but more specifically, enhances B and T cell function. I'll show you a study on that here in a minute. I mentioned viral bacterial infections. Again, improves all of these type of situations. Autism, in fact, very interesting, and we'll talk about it in a little bit more in detail. But some of the earliest studies with DMG actually goes back to the 70s, helping with autism, seizures, any type of focus. And that's what a lot of people noticed when they first tried DMG. They really kind of, in their words, clear out the cobwebs there as well. Arthritis, and again, going back to what we talked about with the X Flame, lupus. Okay, so especially when you combine it with our perna muscle, which is our green lipid muscle, can dramatically help with lupus. All right, and the big C, cancer. Okay, so again, folks, I just want to make a little disclaimer here. We're not making any claims. Okay, and we're not telling you to get off any medications. Always work with your PCP. So, but if you are using things like DMG and working with a healthcare practitioner, working with your PCP, again, hopefully your condition improves so that they can help work with you on lowering your medication or trying to get you, helping you transition, right? But never go cold turkey, and always work with your PCP. So I just want to put that out there when we talk about all these amazing things, right? Again, when it comes to that side of it, okay? We're just showing you the studies, and then if testimonials, case studies come up, I'll share with those as well. Now, of course, safety is always our number one, and DMG is one of the safest ingredients that we can take. In fact, it is actually in every cell in our body already, dimethylglycine, but 99% of us are deficient in it. But there are studies that have been done with at USC, at Clemson. Again, when we made this, there was, this is a little bit older PowerPoint, but so it's over 30 years now, no significant adverse events. And technically, anything as an overdose, you can drink too much water and die of drinking too much water. So technically everything has, but to overdose on DMG, you would have to consume 4,000 pills at once. So it's not going to happen, both physically and financially, not going to happen. So no issues at all in the safety aspect of it. It also will not interfere with any medication. Again, you always want to take it at least an hour apart from any medication, but it will not interfere, only complement. So totally safe, one of the safest supplements in the world. Now, the question always is the dosage. So this is a really good chart to show people exactly what we're talking about depending on your health issue. So right at the very top, you see general use in healthy aging, or as I like to say, anti-aging. Oops, let me go back to that. Healthy aging or anti-aging. All right, so we need to take 125 to 500 milligrams is what the studies have shown. So our chewable is 500 milligrams per chew. Tastes like a cherry tablet. The liquid is 300 milligrams if you fill it all the way up. All right. Now we'll talk about, where we recommend the liquid. You can do either one, but you want to make sure you're taking the right amount. Okay. Now the chewables we are temporarily out of. We have trouble keeping this one in stock, and it should be in any day. But at this moment, otherwise, I would show you, what that looks like. But either one you can do. We just want to make sure you're aware of this. Okay. And this is something I personally have been taking every day since I learned about it 14 years ago. Okay. So people always ask me, what do you take? What do you use? Of course, I have access to any supplement out there. DMG is one of those things I take every day just for foundational health. And again, when we increase oxygen into the cells, it's the ultimate anti-aging formula or ingredient. So always keep that in mind. Now, if you have other health issues, this is where we need to be more aggressive with the dosage. So as we go down the line here and we look at all these different things, whether it's endurance, whether it's diabetes, again, as we talked about, all asthma and so forth, stress, right? So there's a minimum and an upper, right, limit here. But when you break this down, it's really, when you look at this, 1,000 milligrams. Okay, so if we're doing the chewables, it's 2 a day. But we always want to try to take this earlier in the day, unless you plan on working out, because it can give you energy. So it could interfere with sleep. So if you are doing 2 a day, I recommend 1 in the morning and 1 at noon. 1 at noon. Okay. But look at cancer there. So cancer, we need to be more aggressive. And again, folks, this is one piece of a very large puzzle, but it's a very important piece. Okay. But we need to be at 1,500 milligrams. So that would be 3 a day minimum. So the third one would be no later than 3 p.m. 3 p.m. So again, that's active cancer. If the cancer is in remission, 2 a day is what we would recommend. But active, again, the research shows we need to be at 3 a day. The third one no later than 3 p.m. All right. So 99%, of course, people here listening are going to be focused 1 or 2 a day. And again, prevention is always the best medicine. So let's start, just try 1 a day. All right. See if you don't feel and notice a difference. Most people do. Okay. Most people do. So because DMG does so many different things, we're just going to really focus on the studies, and we're going to focus on your major categories here and also the patents that this has. Now, usually at this point, if people say, well, how does DMG work? Well, how does it work on all these amazing things? What's the deal here? So this is a really, when you first look at this, it can be complicated, but we're just trying to break this down and simplify this for you. But this is the methylation chart. Okay. So we're at the very beginning, DMG. And so again, this is in every cell in our body makes this methylation. It goes through these different conversions. So the way it works, we read from left to right. DMG then pulls from the methyl donor and then converts to sarcosine, and then converts to glycine, then it converts to serine. Now, some of it will convert to methionine and SAMe, and then into ATP, energy, which is why most feel energy, which is why we call ours NR-DMG. But then some of it converts right into homocysteine, and then into cysteine, and then into glutathione. Now, again, think about this. It's happening in every cell in our body, every second of the day. This is happening. So it's pretty cool to think about that, right? But I don't care who you are. Even if you tell me you're the healthiest person on the planet, one of these conversions is not happening properly. Okay. Again, there's over 42 conversions. This is a simplified chart that's happening here. But even the healthiest person, one of these things is out of balance. So the beautiful thing about DMG, folks, is that DMG rebalances every one of these methylation markers. Okay. And now there's some supplements who focus downstream. They focus just on homocysteine and cysteine, and that's fine. But if you take DMG, it actually covers all these at the same time. And it's the only supplement in the world that actually can make that statement. So again, why not start at the beginning instead of at the end, right? Now, glutathione is your master antioxidant. It's also your master detoxifier. It's really difficult for your body to take a supplement that's going to increase glutathione orally, but DMG is one of those rare supplements that will do this. Okay. Now let's kind of put this in more real terms with these different methylators and on it. So people typically, if we look at the serine methylator, okay, that is associated with neurological issues, ADD, ADHD, autism. Okay, all those kind of cases, the person has challenges with that particular methylation pathway. All right. Homocysteine, which they do test at hospitals, they do test, most PCPs test for homocysteine. That's cardiovascular methylator marker. So if you have high homocysteine levels, DMG and our Super B are great formulas that have research to lower homocysteine. Okay. And then we get into cysteine. So this is in the liver. So this is why some people can drink coffee or caffeinated beverages after work and have no problems whatsoever and go to sleep. And then some people who drink coffee or caffeine bouncing off the wall for 2 days. And because of this particular aspect of it. So again, if that's you, that's what is happening there. Just kind of break it down in real life. Okay. But just keeping it simple, DMG covers all of this, and that's why it can help with all of these different benefits and functions. Now, we have this book. So if you don't believe one word I just said, right? But this is the book I was telling you about, Dr. Roger Kendall. So we have this here at the clinic. It is available, and it's right here. I actually grabbed it. Okay. So this is what I show doctors and practitioners when I'm out of the clinic here. So there's all different chapters on it. There's a whole chapter you can see on cardiovascular. There's a whole chapter on autism, whole chapter on heart, and on it goes. But it's a really incredible book. If you want to learn more about it, gives the first chapters of the entire history of it, how it came into the United States, and so forth. But whenever I'm talking to someone as a practitioner, they always, if they ask me, well, where's the research? Where's the studies? Right. So I always go to the back page, the index reference, right? And then I just start flipping pages and I say, Doc, do you want those in alphabetical order or top 100? And they start laughing, right? But the one thing that an allopathic medical doctor cannot argue with is DMG, because there's hundreds and hundreds of studies of it. They're just not aware of it is the problem. And that's what my role is to help educate them. So keep that in mind. But great book. I encourage you to read it if you want to learn more about this amazing nutrient. Okay, now with the time remaining, we're just going to focus on the patents. Now, the patents have run out. Typically, patents are good for 20 years. Okay. They did not renew the patents, so we have to use these in past tense, but it's still really powerful to show you these patents. And there's statements that we can make about DMG that we could not make with any other supplement. So the first patent here goes back to June of 1991. And look at what it says here: the treatment of arthritis and inflammation using DMG. Right now, typically every supplement has to have that disclaimer: may not prevent, treat, or cure disease. But DMG actually does not have this disclaimer, or at least it didn't at the time when this was going on with the patent, because they've actually proven to the FDA that this does work. And there's studies to prove that it will help if you take the right amount. Again, 1,000 milligrams a day, minimum 2 a day of the chewable. Okay. Now, so it's been shown in the lab to reduce all these different inflammatory markers. Okay. So these markers, again, might be a little bit, you're not familiar with them, prostaglandin 2 and interleukin 6, but these are the same markers that drug companies test for when they're testing for these. And DMG has the same research and studies that medications have as well. It also reduces inflammation in animal studies, right? And so in the past, we would recommend DMG when we first started, and then we moved on to X-Flame if you're in pain, which has other ingredients as well as DMG in it. And so if you did well with either one of those, great. If you're still struggling, we have the new SPM as well. But keep that in mind. DMG we've had since the beginning of the company. And so when you combine that with our HA Plus for arthritis, the HA Plus is actually rebuilding. Okay, it's rebuilding the cartilage. So we always say we can't rebuild the house if the house is still on fire. DMG, X-Flame, right? SPMs, all these reduce the inflammation, that pain, and then HA Plus rebuilds. Okay, so that's why it's a really great 1-2 combination with this. So you can do regular fish oil, the omega-3D, but again, we have the new one out now called SPM, which is like omega-3 fish oil on steroids. Okay, so it takes two, we get even faster, quicker results. All right, so this is an example, one of the studies, and we reference it there at the bottom, but You see the control group there at the very top in DMG. This is looking at arthritis in animals studies there. So you can see the ones who took the DMG, significant reduction in inflammation in red. And then when they added the green lipid muscle, they got even greater results. Okay. So again, there's studies to back all these different issues. All right. So for arthritis, again, powerful anti inflammatory. It does help to reduce free radical damage. Okay. That's how one of the ways we age, right? Just think of it like rust on the cell, right? And it also helps boost your immune system, which leads us to the second patent. So this is a little bit more recent. This goes back to June of 2007. So it's a two-parter, methods and compositions for boosting your immune and for the treatment of all inflammatory disease. So again, folks, think about what that's saying, right? Treatment of all inflammatory disease. A patent on it. That's really remarkable. In fact, I've never seen it before in 30 years in the industry, any other supplement making this statement, right? Now, again, a lot of that was autoimmune issues, but we work, again, use it with all inflammation, which is a chronic root of almost every health issue is inflammation. So if you have a supplement, if you have an ingredient that it can actually treat all inflammation, right? That's what we're trying to do. All right, so the immune side. So this study was looking at 3 different types of patients at the very bottom, okay? And it's looking at lymphocytes, the T cells, and those are like your Pac-Man. They go around and they consume foreign invaders. So the more you have, the better. And again, it's just, again, one marker that we look at as far as helping with your immune system. So you have the first set here is the first 3 cases are normal cases. The second 3 were sickle cell. So obviously their immune system is going to be weaker. And the last 3 are diabetic, which typically also have weaker immune systems. But look at the before with DMG and then look at the blue after DMG. Every single person, every single case, every single condition significantly improved. Significantly. And by the way, folks, there's no drug in the world, none, zero, that has shown this kind of increase in lymphocyte production. So keep that in mind. Okay. And when I show this to a doctor, they're blown away. They're blown away. Okay. They've never seen the study before. All right. So this is powerful. Seizures. Now, you might say, well, I don't have any seizures. All right. But you might know somebody who does. You might have a family member, a friend, or a neighbor. Okay. So this would be for them. So DMG goes back to 1982 in the New England Journal of Medicine, one of the most prestigious journals in the world, the holy Bible of all medical doctors. They refer to this, right? So check this out. So that we read this is these were 17 patients that were averaging in this study. They were averaging, in this study, the group in this study, they were averaging 17 seizures a week. Okay, 17 seizures a week. They started taking 500 milligrams of DMG. And by week 2, you can see significantly lowered there to 3 a week. Okay. They maintain that dosage of the DMG and continue to stay the course until week 5. At week 5, they stopped the DMG and the seizures came right back to where it was originally. They went right back on the DMG 2 weeks later at week 7, and it dropped right back to where it was. At week 11, they increased the DMG. They went to 1,000 milligrams a day. In this case, that would be 2 of our chewables. And they got even better results with the seizures. They went down to 1 a day. Excuse me, 1 a week. Now, at week 14, they stopped the DMG, but look at what happened there. It didn't go completely back to where it was original. It did go up, but it didn't go up as much. So it's very interesting that it actually helped even when they stopped it for that brief period of time. And in week 15, he went right back on it and went right back down to 1 seizure. Okay, so very powerful. Again, a medical doctor can't argue with this because it's in their own medical journal, right? And so I had a case recently that was averaging 80 seizures a month, 80. I showed the doctor this slide and he said, "Wow, I've never seen this before. I'm going to definitely recommend it to the patient," which he did. The patient agreed to this. At 2 chewables a day, went from 80 to 0 in 1 month, folks, 30 days. Okay, huge. So, again, I've seen this work in real world with seizures. It will not interfere with any medication. Just take it out apart. Won't interfere with seizure medication. But seizure medication has a lot of serious potential side effects, right? So why not try something natural? And again, you can take this right along working with your PCP. So again, keep this in mind if you know anybody with seizures. All right, next, autism. And I mentioned at the very beginning some of the original studies helps with autism. So this is one of the studies here back in 1990 that you can see the baseline there. 80% of people who took DMG, 80 autistic children, improved their verbal communication, cooperation, eating, and bathroom habits. 8 out of 10. Okay, which is huge. And again, there's no drugs in the world for autism that showed 80% improvement. Okay. So again, that's how we would look at this. Now, we took what DMG to another level with the formula called Neuromax. And that's a liquid drink that has DMG in it, plus has minerals, plus B vitamins, which most autism people are deficient in. So you can do either one. We would lean towards the Neuromax. I would start very small dosing because usually autistic people are very sensitive, but we'd start very slow and gradual, slightly increase it over time. But we've seen some incredible cases through the years with autistic kids and older people. Okay. Again, Dr. Rillman is another doctor focused on autism and DMG, got the same exact results, help with sleep too, as well as eye contact. Here's another study that was done with autism. So again, we could pull many of them as well. So Dr. Jung, again, very similar results with autism. All right. Last but not least is this one. Okay. So this goes back to US patent back to 1991, treatment of melanoma using dimethylglycine, DMG, right? So folks, that's cancer, skin cancer, melanoma. DMG has a US patent, or again, had a US patent to treat cancer. Okay. Now, again, one piece of the puzzle, but very important piece. It's the only supplement I've ever studied in 30 years that had a US patent to treat cancer, right? So you might say, how's that possible? Didn't the FDA come after them? Yep, they did. And he took them to court and they won. Okay. And they won. They beat the FDA on DMG. Okay. So you better have the studies to back this up. And for sure, they do, obviously, have a US patent on it. But we're just going to show you one case here, looking at animal and cell cultures, by the way, have demonstrated both prevent and even reverse cancer. Okay. But so this study was done on mice where they injected tumors into these mice. Okay. As this study goes. So what they found here when they were using the DMG, that those who took it had 60% reduction in actually it was chicken embryos is what this study was. They reduced the tumors in these chicken embryos by 60%, 60, right? Just by using DMG. Now you might say, yeah, that looks great. That's a bar graph, right? That's pretty, amazing. But, is it really showing the whole picture? So here is the actual tumors. So these are the slides. You can see in the green arrows the tumors that were formed in these chicken embryos before DMG. Then they took the DMG, and this was 3 months later, 90 days, 60% reduction in these tumors. Okay. So they always say a picture says 1,000 words. That doesn't get any more powerful than that, folks. Okay. So again, we're not making any claims, but this is one piece of a puzzle. But if I had cancer myself personally, you best believe DMG, I'd be taking it. If I had a family member with cancer, you better believe I'm telling him, strongly recommending DMG. Okay. It will not interfere with any medication. Okay. So I want to emphasize that. But that's as powerful as it gets in the supplement world. Okay. Um, Now we have this liquid. We have this liquid option too. Okay. Now I mentioned it's going to be as much as far as milligram dose as the chewables, but who else do we recommend the liquid to? Babies, infants, toddlers. Okay. In fact, it's incredible for ear aches and ear infections. So I've had many testimonials through the years, especially for younger kids, but anybody with earaches and ear infections, if they put just a couple drops in the ear and let it sit in the pocket and let it for like 30 seconds or so, and then they drink it based on their body weight. So at least a half a dropper. Again, if they're larger, toddlers, we could do a full dropper just depending on the severity. But I've had many, many cases through the years within just a 24, 48 hours, it cleared it up in ear infection. So applying it topically and orally for that situation. The other thing that I recommend this for is animals. Okay. Animals. So there's tons of studies and it's in the book. In fact, there's a whole chapter on animals, dogs, cats, horses. Some of the original studies that were done with horses in the 70s, and they actually have stricter guidelines than humans do in the supplement world. Imagine that. But be that as it may, again, totally safe for dogs, cats, and horses. Again, it would be based on their body weight. Obviously, big difference between a dog that's a Chihuahua and a Saint Bernard. But any type of arthritic, any type of chronic inflammatory issue, there's studies on this. It's in the book with the dosage guidelines for them as well. But I would dose it earlier in the day. The liquid, by the way, there's no sweetener. It's purified water. We're only using, there's no taste to it whatsoever. So you can shoot it right in the animal's mouth. And again, in the morning. Okay. So babies, infants, toddlers, and animals is who I recommend the liquid to. Okay. So hopefully that makes sense for everybody. Now you have a better understanding of DMG. Now you understand why we use it in so many of our formulas, including, by the way, our multis. And I've never seen a multi have DMG in it. We use it in all of our colors. I've never seen a fruit and veggie drink on the market have DMG. So you name it, we pretty much have DMG in it, right? So as far as that goes. All right. So Phil, any questions for anybody out there?
Yeah, I mean, out of curiosity, Dr. Verdiales' topic was the secrets behind long-lasting fertility. And since we have a little bit of time, curious if you have any advice for the people watching out there who are
For fertility?
for fertility. Yeah.
Fertility, yeah. So obviously we want to have foundational health, right? So that always starts eating the right foods. And again, that's why these are called supplements, folks. We want to have a foundation, right? Organic, know your sources. If you're eating meats, know where the source is coming from, as far as fish, as far as wild fish, not farm raised. So it always starts there with our food, number one. Are you drinking enough water, hydration? Number two, and you want your cells to look like a plum versus a raisin, right? Exercising on many levels, right? And of course, can help with stress and all that kind of stuff. Are we able to control the stress that you're dealing with? So no matter what we do, that's our first step is foundational health. All right. From there, again, if we're trying to create the perfect environment for fertility, I would recommend our for women are Women's Complete Multi, which um, was actually developed by Dr. V, because it has the perfect mix of vitamins, minerals, superfoods, and a very specific probiotic, probiotic. And so that's where I would always start with, um, as far as that goes. Okay, so lactospores, there's more research on that for feminine hygiene issues and vaginosis and urinary tract and things like that. So it's a very, very unique multi. Most multis just are vitamins and minerals. You're not only getting that in all the absorbable forms, but you're getting this very unique patented trademark spore probiotic called lactospore. Okay. 4-day would be recommended for somebody who's trying to get pregnant. We originally were going to call it a prenatal, but we just didn't want to be boxed in a corner. So anybody, whether age 12 on up, can take the Women's Complete on the female side. Okay. I'd also recommend our omega-3 fish oil as well, because omegas, again, are in our cells. And again, we're getting the good fats to help burn the bad fats. And for, again, foundational health, does hundreds of things, as well. And so, again, very, very important for foundational health there. If you need help as far as eating healthy, eating better choices, we have any of our protein smoothies, whether it's a super shake, whether if you prefer vegan, whether a whey, whether a needle keto, if you have for collagen, right? Or our ultimate shake, which has vitamins, minerals in it already. So we have a lot of different options as far as meal replacements go. If you're struggling eating enough quality food, the shakes take the place of a meal as far as that goes. Um, if a female is out of balance in their hormones, then I would recommend a formula called Estro Cleanse. All right. So Estro Cleanse is really pulling out the bad estrogen of the body and leaving the good. And when we do that, it actually rebalances progesterone and also helps rebalance testosterone. And women do have a little bit, not as much as men, of course, but sometimes it can be too much. And it can lead to things like PCOS and things like this, right? So it's a very delicate balance with women and hormones. We know that. But the Estro Cleanse can really help to rebalance all your hormones and pull out the bad estrogen from the body at 3 capsules a day is what we would recommend for 3 months, or continue while you're still trying to get pregnant. Now, once you are pregnant, we would recommend you stop, go back to the foundational things. But if you're struggling if you feel like there's hormonal issues, the Estro Cleanse is a great formula for them on that situation as well. Zinc, there's also great research on zinc helping with hormones. So I would recommend our Super Zinc 1 a day, both men and women as well. By the way, with Estro Cleanse, if it's a male, because again, obviously it takes 2 to tango here, men, as they age, they get out of balance on their hormones as well. They call it male andropause. And so, again, they are familiar with testosterone, but they're not familiar with estrogen. And as they get higher amounts of estrogen in their body as well, that blocks the testosterone. So, if you're a male or if you're a female here listening, and your spouse has a lot of those kind of characteristics, or the doctor said they have out of balance too, the men can take the Estro Cleanse as well. Same dosage as the women, 3 a day for 3 months. Okay. I would also recommend one other formula for men. Well, 2 other formulas. We do have a multi specifically geared for men called Frontier Men's Complete. Again, 4 a day. It has other ingredients that the women's, it has more for prostate benefit and heart benefit for men. And then I would also look at a formula called Testo Caps. Okay, Testo 180 capsules. And this is going to naturally raise testosterone. It's going to help increase circulation. And there's a little bit of that help pull some bad estrogen from the body, but not as much as Estro Cleanse. So the Testo capsules would be for men 4 a day. All right. There are studies with some of the ingredients that it does help with sperm count and fertility and things like this. And also, women can take the Testo 180, but they don't need as much, right? Because they don't make as much, but just 1 a day. Okay. So, for most of these things, they're the same. right? The multi is a little bit different. Women, obviously, women's complete multi. Men would be men's complete. They both can do fish oil, 2 a day of our omega-3D. The testo capsules for men, obviously a little different. 4 capsules for men, 1 for women, and they both can do zinc 1 a day. So that would be my recommendation if someone is trying to get pregnant or struggling with pregnancy, as far as, but again, foundational health is how we would look at that. Okay. All good. All right, folks, my time is up. I'll be here all day today, Friday, and all day tomorrow, Saturday. If you have any questions, come on down. Again, with free samples, free literature, all kinds of crazy specials going on. So it's a really great environment. I encourage you to come join us. World of Wellness.